Welcome to the International Eczema Council meeting on the human models of atopic dermatitis at this year's 50th ESDR virtual meeting. My name is Nick Reynolds, and I'm a clinical dermatologist with a research and clinical interest in both atopic eczema and psoriasis. And my research focus has been over the years, both clinical, in vitro and computational models of these disorders. So it's a particular pleasure to introduce the faculty to you today. And I'm going to start with a little bit of background about the IEC. So the International Eczema Council was founded in late 2014 as a non-profit global organization, which is led by over 100 experts in atopic dermatitis across 24 countries. The IEC established a presence at major dermatological conferences around the world. And since we've had to deal with the complexities of the COVID-19 pandemic, we've established virtual sessions so that we can keep up to date with the latest research in atopic eczema. Indeed, IEC counselors and associates have also ensured that research is continuing in this area and have convened, facilitated by the IEC to discuss important and relevant topics. And this has led to a number of recent manuscripts that I'll also highlight. So just to go through the IEC mission, this was really brought together to attain a number of really important goals for the field. Firstly, to identify and prioritize unmet needs for research related to atopic dermatitis, and to facilitate this research and coordinate it so that we can provide the infrastructure and bring the relevant experts together. Secondly, to disseminate evidence-based information about this important disorder and facilitate its optimal management to healthcare professionals and the public through direct communication and in conjunction with other organizations globally. This is obviously linked to a third important goal, which is to promote good practices in the care of patients with AD worldwide. And finally, we wish to ensure that the best possible environment is created to enable collaboration of physicians, scientists, and stakeholder organizations. And again, this should be across the globe. There are a board of directors who support these important activities. And I'd like to highlight, first of all, Robert Bissonnette, who's our current president from Montreal, Canada. And just to point out as well, the global reach of the board with Kenji Kabashina from Kyoto in Japan, Valerie Iokai from Sao Paulo in Brazil, and obviously a number of both American and European representatives. Importantly, we also have a public member, Johannes Warso, on the board. So our IEC programs in recent years have covered a variety of important and wide-ranging topics that have been relevant to both the pandemic, but also important topics, including the wide age range that is covered by AD, and to cover the important developments that have gone on in both therapeutics and diagnostics in this arena. And together, these are supporting a move towards a precision medicine approach for AD. Obviously, today we're going to focus on human models of AD. Complementing this activity, there is this bringing together of both associates and members of the IEC with relevant experts so that we can review important areas of research and write articles that we think will be of benefit to the field. And again, these cover a wide range of topics. I'm just going to highlight a few here. Again, important sites, biomarkers, again, supporting priority medicine, priority research questions within the Delphi exercise, and highlighting the importance of education in therapeutics, which I'm sure as physicians we all appreciate. Because of our open policy, it's important that the IEC discloses relevant sponsorship, and those companies contributing to the support of the IEC are listed here, and we're grateful for their support. I'm going to just go through briefly today's agenda, and this is really based on an update of a review that was published in the Journal of Allergy and Clinical Immunology back in 2019. So Bethany Perez-White is going to summarize recent developments in human equivalent or organoid models. Sarah Brown has recently moved from Dundee to take up the chair in Edinburgh, and she's going to present on genetic variation in human models. We're aware that environmental exposures and allergens are crucial in interacting with the barrier to determine flares and disease activity. And Jason Thyssen from Copenhagen is going to present on this topic. Kilian Eirich from Stockholm in Sweden is going to cover human models in vivo. And then finally, Raiko Tanaka, who's an expert in computer science, is going to cover computational models of AD. Finally, we're going to have a panel discussion that I hope will be of interest to the audience. So I hope you enjoyed the meeting, and I'll pass over to my first speaker.